Greetings. This is Mark Cushing with the Animal Policy Group, and I'm co-founder of the Veterinary Virtual Care Association. And VVCA is proud and excited to share this podcast with you because it focuses on two major legislative events affecting veterinary medicine this year, both in the West, one in Arizona, and now recently underway in California. And that has to do with both Arizona and California's legislatures passing by almost unanimous margins telemedicine VCPR friendly legislation. And what we want to do today, as a matter of some urgencies for practices, is to go through what are a great number of similarities between the bills, the laws now in Arizona and soon to be the law in California, point out some differences, but really showcase what we think is emerging from these two legislative victories is a consensus around a model approach to telemedicine VCPR that's measured, it's moderate, it has guardrails, it has basic protections built in, and you'll see those very soon. And I think it'll get people much more comfortable, but also you need to understand what's going to be expected if you're serving pet owners in Arizona and California, and soon to be, we think, a lot of other states. Arizona passed the legislation in May. It's been signed by the governor. It takes effect at the end of October. So basically at Halloween, if you're a practice in Arizona, people are going to begin to call you and want to explore with you a telemedicine engagement for their pet. And you need to be prepared for that one way or the other. California passed the two chambers in their legislature, most recently last week with the California Senate. It was endorsed, believe it or not, by the California Veterinary Medical Board. We agreed to some amendments that they supported, and they made good sense to us. The California VMA was neutral on this. The AVMA was opposed. But I think it's significant that the Veterinary Medical Board in California was on board and registered support for the measure. And so they take slightly different approaches. And my colleague at the Animal Policy Group, Lauren Breen, who's our research and policy director, she's going to walk through for you the similarities and differences in the bills, but keep your eye on how much is common between the two. And I think this becomes a model that other states who may differ as much as Arizona and California differ as states, nevertheless came to the same conclusion about why this is important for pet owners. So with that, I'll come back to close in a moment, but I want to introduce to you Lauren Breen, Research Policy Director for Animal Policy Group.
Thanks, Mark. Both of these bills have important guardrails in place. They both require the veterinarian to obtain consent from the client. This includes informing them they can offer in-person care and being able to recommend a nearby veterinarian. Both states prohibit the prescription of controlled substances. California also prohibits the prescription of xylazine. While Arizona allows for a 14-day prescription with one refill, California allows for a 6-month prescription with one refill. In both instances, these refills can be made during an electronic exam. Any subsequent refills require an in-person examination. California allows for the prescription of antimicrobial drugs with a 14-day maximum. These can be prescribed to food animals. Arizona does not allow for an electronic VCPR to be established with any animals used in food production. In both states, the veterinarian must be licensed in that state with a current license.
Thanks, Lauren. That's a great summary. And interestingly, in California, in joining Arizona in not allowing for controlled substances to be prescribed based solely on a virtual VCPR, they added xylazine to that list, which on the federal schedule is not a controlled substance, but many states are now finding that xylazine, which obviously has currency in the veterinary market, has become a very dangerous, in many cases, a fatal element in human drug consumption. And I just note that might be something that other states take a look at. So what do you conclude from this? Basically, the protection of make sure you get the consent of the pet owner so she or he are comfortable with a virtual consultation and a virtual appointment. If they want to go to a clinic instead, they initiated the call, so chances are they've already thought that through, but give them that choice. And if they want, the veterinarian is obligated to help them do that. You don't use controlled substances. You can't use this as a mechanism to get a controlled substance. There's a limitation on the length of prescriptions. And ultimately, at the core of each state's legislation, the judgment of the veterinarian is crucial. In other words, the veterinarian, she must decide that she can see enough and she understands enough through a virtual engagement, which has to include video, just so you understand. It can't just be a phone call, or it can't just be a text or an email. So a live video engagement gives the veterinarian, in her mind, if it does give her enough confidence to feel like she can help the pet and the pet owner, you can go forward if the pet owner consents. So this isn't a wild, radical, no regulations approach to using telemedicine. And the good news is, because all 50 states allow this in human medicine, people are experienced with it. And there were great fears raised about what would happen on the human side if they allowed for telemedicine. And you don't hear that anymore, because it worked out that people found it convenient, useful. It didn't replace in-clinic or in-hospital visits for people, but it was an alternative when you can't make it for economic or transportation reasons, or you don't need to go to a clinic. You can get the information and the help you need through virtual. And at VVCA, our position's been consistent from the start. We want moderate, safeguarded, thoughtful measures that add this to the toolkits that veterinarians have to help people take care of their pets. Especially vital today because of the shortage of veterinarians and the difficulty, in some cases, impossibility of people getting in-person appointments. So these two states add up to about roughly 48 million people. And this gets the whole number of people that will be able to utilize telemedicine VCPR in the country, soon to be over 100 million, which gets close to a third of America. So guess what? Progress is being made, and I think you'll see much more in the next 12 months ahead. I want to emphasize, however, in California, Governor Newsom, who's a Democrat governor in California, like the legislature is Democrat, he has 30 days from last week, so he has 30 days until, I believe, roughly October 20 to sign the bill or not. The law does not take effect until he signs it. It's expected that he will, but we will advise you, of course, what that outcome is. Thanks for your time, and I do encourage practitioners in those two states, Arizona and California, take the time further to understand how your clinic can keep your clients happy and attract new clients by utilizing telemedicine or virtual care, either through your own staff or by outsourcing it. Thanks. I'm Mark Cushing, again with the Veterinary Virtual Care Association.